Good morning. Good morning. Thank you all for joining us this morning. And I want to start by letting all of you know first how very, very, very much we appreciate the work and effort that is going on now at DHS and around the state, not just at Central, but out in our county offices, at our facilities, throughout our efforts, all that you are doing in this time of a public health emergency. I know I've said this in writing, but honestly, it is when you have a problem like this, when you have trouble, when things are not going well, that is when our agency has its role, and that is when we are to step up and serve our Kansans. And the fact that this is a public health emergency means it is really quite unprecedented what's going on here today, and the response I've seen from all of you is also really unprecedented. You have really been wonderful stepping up and ensuring that our beneficiaries and clients are taken care of. As we go through the weeks ahead, I want you to remember that our clients and our beneficiaries and the citizens of Arkansas are going to need us more than they do now. As we're seeing closures of restaurants, as we're seeing things happen in the economy, as we are seeing even short-term shutdowns of work, it means that a lot of our Kansans who are honestly living paycheck to paycheck and earning hourly wages are going to lose those wages. So they're going to need our services. They're going to need us to help them get into the programs. The need for what we do, whether it's in child welfare, whether it's in terms of adult investigations, whether it's taking care of the people at our facilities, particularly since they're family members and others will not be able to come into those facilities for some time, the need to get people into services and to be able to care for them, to ensure that they're safe in their homes when they're getting home health, that they are getting those services from providers. This is what we're going to have to make sure does indeed, I'm sorry, my mic is going out, does indeed happen during this period of time. So I say thank you again to all of you for what you're doing, and just want to assure you that we will stay in close communication with you throughout this effort. With that, might need a different mic. With that, I want to also comment on the tremendous relationship we've always had, but now it really shows itself with the Department of Public Health. ADH, the Arkansas Department of Health. Thank you. Y'all, pardon me for a second. I'm going to give him this so I don't find myself making awful noises. The Department of Health here has tremendous medical professionals, and they are very experienced and seasoned dealing with infectious disease, and in fact, even dealing with epidemics. And so I want to thank Dr. Joel Tumlison for coming over here today from the Department of Health. He's going to talk to us for a few minutes about COVID-19 and is going to remain and take your questions. It's funny, I've probably talked to Dr. Nate Smith, Secretary Smith over there 10, 20 times a day now. They are incredibly responsive and have been incredibly good partners. So with that, I'm going to let Dr. Tumlison talk a little bit about COVID-19 and coronavirus.
Okay. I think some of this, everyone has unfortunately learned very much about a virus, more than you probably ever hoped to know, but we'll just go over some of it. So COVID-19 is a type of virus called a coronavirus. There are other coronaviruses, there have been for a long time. 30% of your common colds are caused by a type of coronavirus. It just so happens this is a new type of coronavirus, and nobody has any immunity to it. And so that one, makes it new. We don't know as much about it as we'd like to know. Two, this one is obviously worse than your run-of-the-mill common cold coronavirus. It's the other name for it. Some of the naming has been confusing, so I'm just going to go over that. The technical name for the virus itself is the SARS coronavirus 2, which I think is incredibly unhelpful, but that's the way we did it. Why did the big boss scientists do that? It's very similar genetically to the SARS virus that you might remember from 2003, 2004. And so it's not the same virus. It's different enough that, nothing from that makes it certain, but we're drawing conclusions from how that epidemic went to this one. And so the disease, and this is the name I think you see most used, and I think that's better, is COVID-19, which is short for Coronavirus Disease 2019. So that's the goofy names. So this virus, what does it cause? The main symptoms it causes are fever, cough, and shortness of breath. So those are the main ones you want to be looking for in yourself and your family and those people you're serving. Those are the ones we're most worried about. There are some other symptoms that can happen with it, some GI symptoms, some diarrhea, maybe some vomiting. That's been much less frequent, much less than 50% of the time, but it does happen. And interestingly, it seems like younger people, especially kids, tend more to have more of the GI symptoms, and some of the older ones don't have it at all. So those are some of the symptoms that can cause it. How's it spread? I'm sure you've heard over and over respiratory droplets. So what's that mean? Little bubbles of saliva that come out of our mouths when we cough and we sneeze. Even a little bit when we talk. It's just that when we cough and sneeze, they're expelled farther, and so it's more worrisome. Those droplets, generally speaking, hit about 6 feet, and then they fall to the floor or the surface, right? So that's why you're seeing this idea of social distancing. If we can try to space ourselves out 6 feet or so from people, that's what we want to do. And here we are. I'm not sure we're quite 6 feet, but we're all looking this way, so anything is going here. And there's a blank spot in front of us. So that's kind of the idea. That's why it matters what's spread. What's the good news about that? It's not, we don't think it's what we tend to call an airborne disease, such that I'm in here and I start coughing and my virus that I'm infected with spreads airborne throughout this room. Okay? We don't think it's that way, and that's good, because that means it is generally people who are in close contact with a sick person who will get infected. Can you get it from surfaces? It appears that you can. We don't have great understanding of this yet, but it's because it's so new. But other coronaviruses, you can get them that way. They tend not to live for long periods of time, but they certainly can, under certain conditions, on hard surfaces for at least several hours. So thus, wiping our hands frequently with alcohol gel, or washing our hands frequently, very important. We all touch our faces. I think there was a study that showed people touch their faces 80 to 90 times a day and don't even realize it. So it's very hard we need to be more conscious of that. We'll probably cut it down, but are we going to cut it out? That's very difficult to completely stop touching your face. You just do it reflexively. So washing our hands frequently, disinfecting our hands, that becomes very important, because the stuff lands on your skin, you're all right. The stuff gets in your mouth and in your nose. That's how it gets down into your lungs and makes you sick. So those are the basic ideas of how it spreads. Currently in Arkansas, we have 22 cases. We were previously calling them presumptive cases because the CDC was requiring us, when we had finally got the test and we had a positive test, we were required to send them a sample to confirm it. They've now had enough samples within the United States that there was good correspondence between when a state got a positive test and when they retested it at CDC, it was also positive, that they're confident now that a positive is a positive. So henceforth, when we get a positive test here in Arkansas, or with a commercial lab, right, that other doctors are sending samples to, a positive is a positive. We're just calling it confirmed. So that is the situation. There are 22 cases currently in Arkansas. That doesn't include the ones that are being tested now, and I'm not sure if those have been done. There's usually a run in the morning and a run in the evening, and we get samples back from that. So the cases have been diagnosed in several counties, and forgive me, it's not all of the counties, but A couple of new cases were in new counties yesterday. Cleveland County hadn't had a case, and we got confirmation of cases there. So there's, I believe, well, forgive me, I'm not even going to give a number. I think it's around 6 or 7. But you can find up-to-date information as of that day, and they're not updating it hourly, at healthy.arkansas.gov. That's the Department of Health's website, and the COVID-19 banners at the top. You click on there and you can find the most recent numbers when you're interested. It also has lots of links with good advice and other things specific to schools, things specific to educators, things specific to different groups of people that you might find helpful for yourself and also for those you're serving to help educate them or to refer them to. And let me see if there's something else I'm missing. How can people protect themselves? You know, there's been a lot of emphasis, and rightly so, on social distancing. So you might want to, reorder your workspace a little bit, just to spread out a little bit, if that's possible. We want to be it's really important for us not to come to work when we're sick. We're terrible at this as a society, and healthcare workers are the worst. I mean, we're worse than everybody else, and it's causing problems. So when we're sick, I am sure that lots of departments, lots of companies, everyone's starting to finally see we got to put in place policies that allow people to work from home when they're a little bit sick, or have leave policies that fit that. And it's very important now. So don't come to work sick. Don't not only come to work sick, but don't go into congregate settings or public sick. You need to stay at home right now. That's what we need. And that's what we need to talk about with all the people we interact with, is if you're sick, you need to stay at home. And even within home, as much as possible, they need to try to stay away from other people. So if somebody's sick, you've seen probably advice that the CDC does not recommend masks for everybody in the whole country to wear, right? That's because those masks have gaps, right? And things, you can still suck things in. But someone who's sick, it's definitely a good idea for them to wear a mask if you can get one, because that, you can imagine if it's mostly blown out of your nose or out of your mouth, you put a mask on, that's going to block a very large proportion of that, and it's not going to be able to spread out nearly as far. So those are the kind of things that we can do to help protect ourselves. We were just talking on a radio show this morning about how important it is for the elderly. There have been a lot of calls here in the last few days for elderly people, those with chronic medical conditions, to be especially careful in staying at home right now, trying not to go in congregate settings, not getting in contact with anybody who's a hint of sick, maybe even not being around little kids, because they can have it's not that little kids are germ baths or something like that, it's that with this disease, children can be infected, but they don't show symptoms as often as older people. So they could be sick and not even really, you wouldn't even know it, and they wouldn't even know it. Now that's not real common, but fortunately kids are more spared by this disease. They can get infected, but there have been very, very few cases of severe disease in children, and that's a blessing. But those are some of the things that you can do to help keep yourself safe, that you can advise others to help keep themselves safe. I was saying about the elderly, and I'm sure DHS does work with elderly groups. So getting that out there and just organizing community groups to be checking in on their neighbors. This is really important. I've heard some good news about different groups and churches in particular that are, appointing people to follow up. Well, you get this congregant, and you get this member, and you get this member, and you have to call them every day, and you need to check up on them. You need to get them anything they need, because they shouldn't be out and about and going to the store where they might expose themselves and be at more risk, because the elderly people are at greater risk for severe disease if they get sick.
It's really great. Thank you very much. Really, really appreciate it. As I said, we will take questions at the end, but before we go to that, I was going to ask Amy Webb, our Chief Communications Officer, to talk to you a little bit about the materials and information that we're trying to organize and have available for you, as well as some of the options we have for you to ask questions at all times, and to be able to, because this is changing very rapidly, and so we do want to be able to have a good, strong communications effort to ensure that you have the latest information from us. Amy?
So as Cindy said, we want to make sure that you have information. Can you hear me okay? We want to make sure that you have information when you need it, and it's the most up-to-date information. So one of the things we did yesterday, and you may have seen an email about it this morning, is that we now have a web page for employees related to COVID-19. If you go to our website, humanservices.arkansas.gov, on the right-hand side, you'll see an orange button that says COVID-19 information for DHS employees. We are going to be posting everything we can there. So any updated guidance we get from the Department of Transformation and Shared Services, we will post it there. We posted some new stuff last night there related to the leave policies that they provided us last week. So you can go there and find out any information. You can also find the link to the out-of-state travel form that we sent out yesterday. And you can also find the email address, and I have to look at this because I won't remember. But if you have questions that aren't answered, on the health department side or through the information on that website, and your supervisor can't answer it, then you can email us at employee, no S, concerns@dhs.arkansas.gov. And we have someone who's monitoring that mailbox during the workday every day, and we'll work to get you an answer, and we'll be putting up some FAQs in the coming days on that website as well.
And Amy, that does include a link to the Department of Health's website?
Yes, it has a link to the Department of Health's website, and it also has a link to the travel guidance issued by CDC. As the governor mentioned yesterday, people can still continue to travel, but you are encouraged to look at the CDC site and see what's happening in the places where you're planning to go, and then make decisions from that end.
Yeah. Amy's trying to make sure that Amy and her team, that in one place you can go and find all the information you need and the links to be able to go and get current, up-to-date guidance. As everyone has said, this is changing daily, and so please use this website and please use the email to send us questions. Y'all are also going to post answers, correct?
Yes, so we will be putting together an FAQ from questions we get today and other questions we get in the email box. And we will be posting that and sharing that with you guys. We're also recording this, and we'll share it as well for people who weren't able to watch it. So if someone asks you, we'll post the link as soon as we can. And if we don't get to your questions today during this Zoom, we will get your questions answered. So just know that we're working on that. I know we have a limited time, and the health department just for a little while. So we appreciate you coming.
So with that, we will move to take questions.
Okay, and I already have a few. So the option to close county offices and have clients fax, email, call. Can you talk about what our processes are now around that and how that works?
I certainly can, but I'll tell you who knows it better than I do is Mary Franklin. So to make sure, well, Mary, would you mind coming up here? Director Mary Franklin, to talk about how county offices currently work, as well as some of the areas where we have been making some adjustments.
Good morning, everyone. Right now, our offices are still open to the public, and we have some processes already in place, and we're going to enhance those processes as well. But some of the things that we already do is we do not require face-to-face interviews. In Medicaid program, we don't require interviews. We communicate by mail or phone if we need to. In the SNAP program, people can choose whether or not they want to be interviewed face-to-face or by the phone. And we're trying to do as many of those as we can by the phone. The TEAM program, we will soon be eliminating that face-to-face requirement. And we have also done some things for our folks who do have to travel normally as part of their work, our field investigators, our quality assurance reviewers. We have gotten a waiver so that our quality assurance reviewers are not doing in-home face-to-face interviews. They're able to do their work by phone. And we have restricted the field investigators to do desk reviews and do telephone and letter contact. And we'll be working meeting with management in our county office very soon to go over some new procedures so that for the folks who do need to still contact us in person, maybe they don't have access to the internet or they don't have phone minutes that they can get to our office, we're going to work through some processes to help that be safe for both our clients and our staff.
Thank you, Mary. Great. Next question.
All right. Are there any provisions for employees in high-risk groups like age or medical problems in terms of working remotely?
I think each division director and chief is looking to determine, they're all nodding at me, yes. Each of them is looking to identify the employees they have that are older, and older being a kind of unsure term. As a 62-year-old, I do plan to continue working through this, but who are older and who may have in some way a compromised immune system, and to help identify those individuals and work on shifting them into a remote setting where it can be done, find some work they can do remotely in order to be able to continue serving but not having to come into the office. So that's going to be coming to each of you through your divisions and your chief's offices.
All right, so
Amy has turned into official interviewer now because she's gone back to her media roots.
is diabetes a risky medical condition with this virus? What about ACE inhibitors? We'll get real specific.
So diabetes, yes, is a risk factor for not necessarily for getting infected, but for having more severe disease. So the main chronic medical conditions that seem to be problematic are the ones that physicians would expect. Heart disease, so congestive heart failure, had a heart attack before, any kind of heart disease, diabetes, lung disease, so COPD, emphysema, and chronic kidney disease, or any kind of condition or medication that causes you, as Secretary Gillespie said, to have a compromised immune system. So those might be you have a condition that, an autoimmune disorder, and it doesn't directly cause you to be more prone to severe disease, but maybe the medicine you take for it does. So those are the things that we mainly worry about.
So could you talk to us a little bit about testing, like the availability of testing? Are people charged for that?
Well, the Arkansas Department of Health does not charge for the test. We have a somewhat limited number of tests that we can run daily. That capacity is increasing, it is improving, and we're hopeful it'll be even improved by the end of the week. And so we're hopeful about that. The real increase in capacity of testing is through commercial laboratories. These are labs like LabCorp, and you've probably gotten a bill from some of these places before. LabCorp and Quest, and there's a whole bunch of them. And your doctors use those labs all the time for all kinds of tests. And so there aren't, to my knowledge, any places in Arkansas, big hospitals, wherever, that can do their own tests yet. Several of the big centers are working on being able to do their own testing, but it's not quite ready yet. But those places can do send-outs to those big laboratories. So what we're trying to do at the Department of Health is prioritize those we need an answer on fast, because if you send it off to LabCorp, they've said maybe 7 days. Some of them are coming back faster than that, but sometimes we need an answer as soon as possible. And so getting it to our lab is the fastest way. So we're prioritizing testing there for people who have had, I'll just briefly, have had contact with a known case and they're ill now, and people who are in nursing homes or other institutionalized settings like a prison, people who are hospitalized and they're quite sick, not somebody who's hospitalized because the doctor thought they had COVID-19, but their condition is well enough to go home necessarily, but somebody who's hospitalized because they're quite ill or in the ICU. those are kind of the ones we're trying to prioritize, but we're starting to be able to liberalize that a little bit.
Amy and Damien, could one of you two talk about the UAMS screening that is available for someone who wants to, I mean, they have put in place a screening option, which one of you could discuss, that allows someone who wants to figure out whether or not they should go to their doctor to request or call their doctor to request a test?
So that was in some information that actually Amy had sent out, I believe, last week, but it had 3 options as far as a phone number, a website, or a triage that people could go to actually be tested. So that information, I'm assuming, is on our new site if you need to kind of look and see kind of the hours as far as the triage and the phone number and the actual website.
And the UAMS tool is really a self-screening tool, so it gives you guidance. Like, say if you have fever, it'll walk you through some questions to help you figure out whether you need to take some additional steps, that you're more at risk for actually having COVID.
I can speak to that a little bit. Yes, they do have those things. They've even got like a telehealth portal video chat with a nurse or a nurse practitioner or something like that set up. So those are good options. But what we don't want is everybody in the state thinking that they've got to run up to UMS, and they have a screening facility now to keep people that have fevers and stuff. It's outside of their ER, so you don't even have to go in the building. But other places around the state are setting up these same things. They're just not quite as far along. And so that was what I say, like, this would be helpful for DHS workers to be the eyes on the ground to learn about what's going on locally. I heard St. Bernard's is doing something similar in Jonesboro, and in different hospitals in Northwest Arkansas have also set that up. So some of those are already up and running. So people need to know what's available locally for screening facility. Always calling your doctor is a good thing. Your doctor hopefully will know what's available locally, but they can give you some good advice on whether you should come in or not. But calling ahead wherever you're going to go is important. Because if you just walk in and you do have it and you walked into the waiting room, now think of what that's going to mean for that healthcare facility or Department of Health or things like that. So calling ahead, very important when seeking care.
You talked a little bit about the guidance in terms of masks. We have employees who go to homes, and so they want to talk a little bit about that in terms of what's the guidance around masks.
So, yeah. Generally speaking, masks aren't as great to keep a person with no symptoms and no prior exposure from getting sick as we would hope. However, it is better than nothing. If someone is symptomatic, like you have to go visit someone who's got coughs, who's got fever, I would recommend. This is what we're even recommending for doctors. You may need to go talk to this person, but that doesn't mean you have to be right there like you usually would be. Stand back and have a discussion with them to see if you really need to get up and touch them. So I think that kind of social distancing is something we can do right now, whether somebody's sick or not. We can just say, you know what, this is weird. I know we're not used to this, but we can stand back and have a little farther away discussion than we would normally do. Does that help?
Would you like to add anything?
No, I think that's great.
Okay, great, thank you.
So when does a person exposed to COVID-19 become contagious?
So this is a question that doesn't have a great answer. We're now thinking that it's possible to shed virus, meaning you could be shedding virus out of your mouth and nose prior to developing symptoms. Some viruses do that, some viruses don't. And so with the original SARS virus, it didn't do that. Really, it didn't seem like people infected others until they got symptoms. This one, there's some evidence that indicates maybe it's possible for maybe the 2 days prior to starting symptoms. So it's not a really long period of time where, if it was like a whole week before anybody started symptoms, well, you'd never know who had it. So maybe 2 days. That's medical professionals being cautious to try and see who else we need to get in contact with who've been around known cases. Well, let's move it back a little bit so we're not missing people. I know that makes it a little more worrisome to people, understandably, but that's us trying to be cautious to catch everyone we can early so that we can help them isolate themselves and not pass to more people.
Could I ask a question?
Sure.
Thank you. Could you tell us what the Department of Health does in terms of your investigation when someone does test positive for
Right.
COVID-19?
So when we get a positive result, they first tell the doctor or providers who treated that patient or are treating that patient. Even before that, as soon as someone wants to test, for those doctors sending to commercial labs, we put out the information that, hey, if you're going to test somebody, you need to send them home and tell them to quarantine themselves. They need to isolate themselves until we find out. And the same thing, if we're testing somebody at ours, we give them instructions. You need to be at home, in your room. If you're going to be around family members, you need a mask on, and start that process then. So if they're confirmed, that would continue, and then we would start doing what's called contact tracing, which is just trying to find everybody they were in close contact with, right? Like, if I have it, and you're in this room, we're probably not going to quarantine you, but we will quarantine him, if that makes sense. So within that, and if it's a household, certainly everyone in the household is going to get quarantined. People that we know had close contact for a prolonged period of time. What's a prolonged period of time? It's vague, 15, 30 minutes. It just kind of depends on the judgment of what the interaction was like. I mean, maybe you were only there 2 minutes, but if you held on to that person and hugged them for those 2 minutes, then that's close contact, right? So those people we try to find and we get them to quarantine themselves. And then we start looking for as many of those close contacts as possible. Then we stay in touch with them, give them phone numbers of nurses, whoever they need to call, in order that if they start developing any symptoms, we can get them tested early rather than late.
All right, well, we have exceeded our 30 minutes and then some, which we promised the health department we would.
I mean, if 5 more minutes of questions will be fine.
Okay. Somebody said, what if they go out of state? Do they need to get tested?
This is a difficult question. Right now, we are not, first of all, we don't test anybody that doesn't have symptoms, all right? Because we don't have that many tests, but primarily because we don't even know if the test is valid if you don't have symptoms. Why? Because early in an infectious period, early before you are infectious, you might have, this goes to this idea of incubation period we've all been hearing about, right? Early in your incubation period, you could have the virus in your body, but you're not dumping it out anywhere, i.e. it's not in your nose, the back of your nose where we're sampling. So you could have it, we sample it, it's negative, we all feel good, but it was really that we just caught you too early. So we're not testing people who aren't symptomatic simply because the science isn't there to say the test is valid when people don't have symptoms. But if people have been out of state, it really, at this point, it's very difficult because it depends totally, not just what state you went to, but where in that state you went to. Is there a local outbreak going on in that place? Did you have contact? Very, very quickly, we're moving away from where did you travel from to who did you have contact with? Were you around a sick person? Were you around someone who's being investigated? And that's kind of where we're moving. We're still getting international travelers, we're asking them to quarantine themselves, especially from certain parts of the world that are those level 3 CDC travel places, which now is all of Western Europe, as well as China, South Korea, Iran. I believe those are the level 3s at this point. Was that a good answer?
Yeah.
Okay.
I'll give one last question. And really, people are asking, okay, so they've said 2 weeks. Schools will be closed for 2 weeks. Can that change? Will that change?
That could certainly change. And will it? I don't know. I mean, we're doing what we can early to try to blunt it as much as possible. The virus is going to spread. What really is in question now is how much. And the good news is all of us can have a role to play in how much it spreads. If Arkansans in general just say, whatever, I'm going to do what I want, and everybody does that, they go out and everybody's mixing even if they're sick and yada yada, then it's going to spread more. But if people are cautious, we take these precautions that we're being urged to, it's going to spread, but it's going to spread less. And that means fewer people get sick, and it might end sooner than it would have.
Great. Thank you, Dr. Tumlison. We really appreciate it very, very much. This has been incredibly helpful. To summarize, let's all continue to remember that we try to stay 6 feet away from each other. Create a little distance between yourselves. Don't talk right at anyone. Most importantly, if you are sick, whatever it is, all right, whatever your symptoms when you're sick, stay home from work. Because flu is still going around, other things are still going around, so if you are sick, stay home from work, right? That's very, very important. If you should be quarantined, then in addition to taking the actions they will ask you to take, if you're quarantined because of potential exposure to someone, right? Obviously, you'll take the actions that the Department of Health and your doctor tell you to take, but also let your supervisor know. Here at DHS, your supervisor is going to go directly to the director of their division, and or the chief, and that director or chief is going to come directly to me. And our team is going to work directly with the Department of Health. All right, so we are making sure, let your supervisor know. You will usually have a letter if it's Department of Health, and you'll have something from your doctor. Same thing applies if you are tested and are found to be positive. In addition to taking the actions that your doctor and the Department of Health tell you to take, let your supervisor know that. You should at that point have already been home and been quarantined and isolated, but let your supervisor know, right? And they will immediately reach out to the division director or the chief, who will reach out to me. And we will reach out over to the Department of Health, right? So we are all working very closely together as an agency, and we're working very well together inside this organization. And I'm just going to close by saying one last time, we truly appreciate the work that y'all are doing. In these times, when some of the private sector activities can shut down, government can't, we still have to provide core services to people. Those of you who work in facilities, you are really even more critical at this time than others, because visitors are not allowed in those facilities, and you are the ones who are taking care of those people. So thank you again for your work and your service. I can't tell you how proud I am to work with all of you in this time, and to see what we have seen in the reactions of our employees to care about the people we serve. So rest assured, we will stay in close communication, and you'll hear from us every single day. And I think Amy wants to say something.
Yeah, I was just going to say, we have lots of questions that we did not get to. So we will work on getting answers to those and getting those out to everyone.
And we will post all of those. You're posting this on that website that we have. All right. So, and then please use the mailbox that Amy has set up to send other questions. Thank you for tuning in today.